Hello, Dr. Aditi here. Today we're zooming into a very small but mighty muscle that makes your thumb go like this. So this is the Flexor Pollicis Brevis. And this muscle, like when you're learning muscles, most people learn origin, insertion, right? And then action. However, I find that the best way to learn it is know the action first, because once you know the action, you can sort of figure out the origin and insertion. So we know that the Flexor Pollicis Brevis does this, right? So it's sort of a kinesthetic trick, and I'm going to show you some mnemonics and analogies to help you learn this muscle. By the end of this video, you'll know where it is, what it does, but also how it plays this crucial role in everyday functions like gripping your coffee mug or texting your friend. So every time you do those things, it's going to go into your brain and go, oh, I'm using my Flexor Pollicis Brevis, right? That's why it's a great sort of kinesthetic way of learning, to learn the action first and then sort of learn the other aspects. So let's get cracking. All right, so quick name breakdown here. The name tells you everything. Flexor means it bends. Pollicis means thumb. So you know it bends the thumb. Brevis means short as opposed to longus, which is a whole different muscle. So Flexor Pollicis Brevis is the short muscle that flexes the thumb. That's all it is. So the name tells you almost everything. And it is comprised, or it's part of the thenar muscle. You do need to know that too. All right, let's look at the action, right? So the flexion of the thumb is what it first does. So basically what happens is the origin is in your carpal bones, which we'll go over, and it sort of pulls down here because the insertion is right there. So what it does, it pulls down and it creates the flexion of the thumb, but it also creates opposition of the thumb and medial rotation of the thumb so that you can do opposition and touch your little finger, and you can hold things like a mug, for example. Right, now you know the action, you can kind of surmise where the origin and insertion is, right? So the action is this flexion, right? So we know that the insertion is going to be up here somewhere, because wherever there's insertion is where the action occurs. And then the origin is probably going to be in the carpal area down here, right? So let's look at it. The origin is actually, there's two heads there. It's like a fork in the road. So the superficial head is actually in the flexor retinaculum and the trapezium, and the deep head is going to be in the trapezoid and the capitate bones of the carpals, right? Now that's the origin. So those three yellow spots you see. Now the insertion is actually going to be a little bit different. It's going to be way up here. It inserts on the lateral side, so the lateral side of the base of the proximal phalanx of the thumb. So it's going to be just beyond the knuckles, just right there. Because as you can imagine, it pulls, and then that's how your thumb flexes, right? So that's essentially the origin and the insertion. So again, do you see how once you know the action, it's actually, I don't know, I find it a bit easier to figure out the rest. All right, now let's look at the innervation. The superficial head is innervated by the median nerve, but the deep head is actually innervated by the ulnar nerve. How do you remember this? We have a mnemonic for you. Most fingers median, but deep thumb gets ulnar. That's how you want to remember it. Super easy and simple. All right, so let's talk about how does this show up in our everyday lives, because this is going to be the key to memorizing this. The Flexor Pollicis Brevis is a very small muscle. It's part of the thenar eminence, that fleshy part of your palm near the base of your thumb. And while it's very tiny, it's very important, right? Because you can flex, you can pinch, you're texting, you're zipping up your jacket, you're buttoning your shirt, you're holding a toothbrush, driving a car, right? It requires very precise movement and strength. This one tiny muscle lets us do all these things. Now, when the Flexor Pollicis pollicis brevis is weak or it's injured, even small tasks like turning a key or opening a jar or writing with a pencil can be awfully frustrating and painful. So when you're working with a client, whether it's in rehab or recovery or strengthening, we really want to pay attention to the functional demands that's placed on this muscle on an everyday basis. Because if you help someone improve flexor pollicis brevis function, that can really significantly increase their independence with fine motor skills and self-care tasks, so they can be very independent. So think of this as the muscle that helps you press a button or grip a zipper, you know, that small bend with a really big function. And the one thing that I always think about is texting, because we do it all the time, right? So every time you're texting, sort of kinesthetically cue yourself, this is the flexor pollicis brevis in action. And that will definitely help you. And then, of course, you could always try to memorize the origin and insertion. Okay, so quick recap. Origin is going to be in the flexor retinaculum area, trapezium, trapezoid, and capitate, because there are two heads. And then the insertion is going to be in the base of the proximal phalanx of the thumb, so right above your knuckle right there, and it flexes at the MCP joint. The innervation, remember, median is going to be the main one, but then the deep one is going to be with the ulnar nerve. Use in daily function, pinching, pressing, texting, anything that's thumb related is going to help you do this. The flexor pollicis brevis is going to help you do this. As usual, I always end with a mind map, and here we have flexor pollicis brevis, which is the muscle that is like a Swiss Army knife. It sort of flexes and goes across your hand right there. So again, if you want to do this, this is a good kinesthetic tip, and this mind map serves as a visual with all the key elements in it for this specific muscle. So as I said, one of the strategies to learn these muscles is to learn them individually and then group them. We tend to learn them in groups, but I find it a lot easier to learn them individually, and then I'm able to kinesthetically remember their actions, and the action cues me into the origin and the insertion. So hopefully that was helpful. If you'd like a download of this mind map, do comment and let me know, and I'll see you next time.